I guess, yes, doctor, your voice is coming. Dr. Dhanesh is, I don't know where he's gone.
Okay, okay,
Yeah,
okay.
you can start your session. Yes,
I
please.
can start my session. Okay,
Yeah, yeah.
welcome all. We have yeah, I'm Dr. Bavdekar. Firstly, I'll have some few words about our IFPH. So, firstly, I welcome all of you along with the speaker. Some few lines about IFPH. Friends, this International Forum for Promoting Homeopathy, it is an organization which is formed to bring together the global promotion of homeopathy, and also to bring together all the homeopathic movements, activities worldwide, and under all these things under one umbrella. This IFPH community, uh, basically, it like in this community, region, caste, religions, political divisions have no place. The main purpose is to concentrate on the field of homeopathy and to promote homeopathy. So all the homeopathic students, doctors, homeopathic lovers, homeopathic interested people are welcome to join this. Witnessing the day of the world, IFPH humbly says that popular, simple, and less expensive homeopathic medicines can save today's world, which is relatively different from other systems of medicine. And it is very helpful in defeating today's catastrophe. IFPH also understands our mission is to bring and identify to the attention of general public. To fulfill the aims and objectives, we are conducting the Zoom webinars daily from September 2020, so almost 5 years. There are daily 3 sessions from 7:30 p.m. India to 8:30 it is in Hindi, from 8:30 p.m. to 9:30 it is in English, and from 9:30 p.m. to 10:30 p.m. it is in our local language, Malayalam. So friends, this is now this webinar which is going on. This is one of like from 2020 it is going on and daily it is conducted. Now everyone is warmly welcome to join this meeting. Please join us with your name and video is a humble request to all of you. Most our most of our all videos are uploaded on YouTube on regular basis. You can also see them on the channel on YouTube by searching International Forum for Promoting Homeopathy. This was a small introduction about our IFPH. Now, I welcome you all to our today's guest speaker. Just few words about sir.
Yes,
Basically,
sir, we can introduce our guest after his arrival because he is
acha.
on
Sir is
call. Yes,
okay, 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 sir, okay,
I
sir.
shall make an announcement about our
Sure,
celebration first.
sure, sir, sure.
Yes, as you all know, the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th of September at Taj Vivenda, Cochin. And it's a very important meeting as far as we are concerned because we have started all these things during at the time of COVID when there was no possibility of meeting one another and discussing about what to be done, what can be done, what are the things which how homeopathy can manage the COVID cases. But as you all know, that it was forbidden that no other medical system can practice for COVID like that. But everything changed later, and we worked together. There were doctors from 70 countries attended the same Zoom sessions, and they have narrated what happens in their countries and how it can be managed with the homeopathy. And after a long discussion, our as a National Homeopathy Commission Chairman, Dr. Anik Kurana, came out in this platform and stated that homeopathy is the best preventive. At that time, he has submitted the presentation in this forum for the first time in the history of homeopathy has come into the picture. And later, that report was submitted to the Supreme Court of India. And on the basis of that, the government has, Supreme Court has given order to for the same, and thereby we were able to give preventive as well as treatment alongside with the other system of medicine also. But once a patient came to homeopathy, we were able to treat just like any other disease. It is not like a terrorful disease as far as a homeopathic doctor is concerned. We just they took the symptoms and after giving the right remedy according then in accordance with our laws of principles, we were able to cure within 5 to 7 days in most of the cases. There were no complications after taking homeopathic medicine. It proved that homeopathy works at everywhere and whatever be the situation. And so after that, we have a very good presentation one by one from doctors about how they treated COVID cases. So these are records that need to be looked into because those things are not known to anyone. And as you all know, in this we have arranged 1,000 celebration some 3 years back, but this is the first time that we are coming over here and celebrating the 5th anniversary. That is being in a good venue, as you know, it's an international hotel that is Taj Vivenda Cochin on September 28th from 8 a.m. to 6 p.m. and in which we have uh, Honorable Sri Jadav Pradabro Yenavathro, the Honor Minister of State Independent Charge, Ministry of Ayush and Family Welfare, who will be coming over here to inaugurate. And that's a great thing as far as we are concerned. And other guests of honors, the keynote speakers are Mr. Baby Eden, MP, Mrs. Kumar Thomas, MLA, Mr. Anil Kumar, Mayor Cochin, Dr. Subhash Kaushik, Director General, Central Council of Research in Homeopathy, Justice Mr. Harikaran Nair, a former Judge, High Court, Kerala, Chairman, Ethics Committee, Kerala University Medical Sciences, Dr. Beena MP, Director, Department of Homeopathy, Government of Kerala, Dr. Vijay T.K. Principal, Controlling Officer, Government Homeopathic Medical College, Trivandrum, Mr. Dr. Hello Pereira from Portugal. He is a practicing homeopath. Dr. Stingdom from Denmark. And there were some felicitations by Dr. K.R. Janardhan Nair, ex-president, Medical Assessment and Rating Board, NCS. Dr. Sarjan D. Edison, student representative, Engineer Salahuddin. He is a person who was instrumental in bringing up homeopathic lovers and doctors together. He is the originator of IFPH. And there will be some award ceremony too at the end. And this is what about the inaugural session. And after the inaugural session, we have arranged some other programs also. That is some scientific sessions also. The scientific sessions which begin with the 5 minutes presentation from different categories. That is one Dr. Kanchan Pradeep from a junior doctor from Jaipur, Dr. Roy James, MBBS, DGO, BH, and now he is studying BHMS in Calicut Homeopathic Medical College. And another one is Mr. Shalu Rajan. He is the student wing coordinator for IFBH. Mr. Albi PV, homeopathic lover, who is recently translating the Kent Materia Medica into homeopathy in Malayalam. Then as a big session, that is about 20 minutes from Dr. Ravi Singh, and he will be talking about can homeopathy replace surgery, real-time clinical evidence. Then Dr. Vinakrishnan, MD Homeopathy, he is talking about lung cancer stage 3B and 4, homeopathic intervention, a case series study. He's a researcher also. He is the person who is who is running the district homeopathic hospital for this cancer treatment that is specified by Indian. And thereafter in the evening, we have a 3 presentation from veterinary homeopathy by Dr. Mustafa, then on dental homeopathy by Dr. Santosh Kumar, and agro homeopathy from Dr. Y. Bauche. And in the evening, we from 4 p.m. we have some cultural programs too. Our guest has arrived, so I am inviting Dr. I hope all of you will register for the same, and those who are unable to come over here can contribute a sum for IFBH for the success of the 5th anniversary celebration. And over to Dr. Indrani Bhavatkar to introduce the guest of the day, Dr. SHASHI Mohan Sharma, sir.
Yeah, so thank you, sir, for handing over me the session. Yeah, so friends, sir has just joined our session. We are very glad to have this 1849th session of IFPH today. Now, our today's guest is Dr. SHASHI Mohan Sharma, sir. Sir is BMS PG Home from London, FBIH from UK, and sir is a director and principal of the Hahnemann College of Homeopathy in UK. He has a very vast experience. He has an experience in homeopathy for about 52 years. So he will be sharing his topic today, that some of my clinical experiences in homeopathy. So friends, we all are very eager to hear sir's experience. And also I welcome sir, being a very senior most practitioner, to kindly take the charge and start his lecture. Welcome, sir. Yeah.
Hello, good evening. Can you hear me?
Yes, yes, sir. Yes, we can hear you.
I was very busy whole day this morning because I had 4 meetings. No,
Oh.
this is the internet meeting with you. I'm happy to join you because I was very busy. I didn't remember is any meeting tonight. So Dr. Dinesh just called me. So welcome everybody. Today I'm going to share some very important cases where I am very successful. I was very successful because of selecting a proper remedy. Lot of things are happening in the homeopathy world. There are so many doctors on internet telling silly things to the people who are not homeopath. The first thing is they are not following the homeopathic principles, similia similibus curenta, and teaching of Dr. Hahnemann. There is a lady doctor, she was telling, for your condition, you can take sulfur 4 drops of water in the morning, 4 drops in the evening. So I don't know how some qualified doctor like her is telling someone to take 4 drops of medicine. 4 drops of any medicine is not a homeopathy. Homeopathy is a single, simple minimum dose. Otherwise, there will be no cure. Maybe there is a palliation or something you can call it. There will be more harm rather than getting good results. So first thing is, please follow Hahnemann, and his teachings are very, very professionally tested and internationally acclaimed. His education, his teaching was the best in the world. Even the doctors in the United Kingdom, they believe in homeopathy. And the father of allopathy said Hahnemann did to the humanity which no one did in the entire world. So this is that's like my suggestion to you. Please use single remedy and do not mix remedies. And a lot of doctors are telling from India, for this condition, take 6 bottles and 4 bottles of biochemical and homeopathic medicine and mix them together. It's not homeopathy. That's why homeopathy is being ruined by us. We should not blame anyone. One doctor was telling, take 4 medicines and mix together and give to the one eczema patient. Graphitis, sulfur, petroleum, and one more medicine. I said, this is not homeopathy. You can't have 5 religions and say, I am practicing Hinduism, Muslim, and Christianity, Zoroastrian, and some other religion. You should be only one and single religion follower. That is the best. Okay, that was my suggestion. Now I'm coming to the one case I told you last time as well. There is a patient of sciatica left side, and pain while lying is better. So I gave her rust talks in the beginning because there was a problem of moving around, rising from the chair, and there will be pain will be more severe when walking is better. So I again did the repertory search, and the remedy was ammonium mure. Ammonium mure, very, very good remedy for left side sciatica, where patient is feeling better by lying in the bed. So in 3 days only, I got the good news that my pain is gone. So always trust homeopathy and treat patient according to the Hahnemannian treatment procedures. Lot of doctors are giving mixed remedies. They are not helping anyone. They are just spoiling the case. About half an hour ago, somebody came to me, and gentleman have the very, intense acidity. So I reporterized his case, and medicine was Nux vomica. Nux vomica should be given in the evening and night only, not in the daytime, not during day. You can take it in the afternoon, no problem, but the best working in the night. And he said, I can't sleep whole night because of the acidity. So I will see what the results. Actually, he was sitting next to me, and I was really absorbed with his talk, and he's a very spiritual person. He is one of the secretary of the temple in UK, very famous temple, Swami Narayan Temple. He PhD himself and is very knowledgeable person. So I was listening to him. I just walked out with him. Then I know Dr. Dinesh told me today is a meeting. So I came back. I said, you go now. Where are you going? Let me go to my office. Another case. We are always talking that I did this, I did this. I said, I didn't do this. It is homeopathy did it. I tell you something very, very special. It is already here in the bookmark. Let's see. There was a patient of a chest problem and the pain in the chest. You'll be surprised. He had the pain in the chest when blowing in the nose. When he was blowing in the nose, there's a pain. Can anybody tell me the remedy, please? It should be interactive today. Which remedy will help somebody blowing in the nose? Please. Anyone? I found single remedy. Chelidonium. Blowing the nose is whenever he is blowing the nose, there is a pain in the chest. And in extremities, a lot of people are suffering with the pain. There is another case of the pain in the lower limb. And it was very simple remedy. When rising from the bed is the pain. Is walking is the better. You know the remedy. Can you please anybody tell me what is the remedy? It's very simple and very prominent remedy. Rust talks. When he's rising from the bed, there's a pain beginning to move and better by walking around whole day. The remedy is rust talks. And homeopathy works and always works. We never fails. And there's another very important. I just find out where it was. When somebody is walking on the stairs and he's feeling very trembling in the legs. Any remedy? Going upstairs and trembling legs. Very special remedy. Can anybody tell me the remedy when going on the steps and feeling of trembling? Our materia medicas and our repertories are most important information we have. And tried and tested from Dr. G.T. Kent. Kent repertory is one of the best repertory in the world. Even the Murphy followed another Dr. Boning Hassan and all doctors are there. But Kent is the most authentic remedy. I tell you one very special case, because today we are talking of the case. When the swelling in the leg, we think of epismel, other remedies, but the one best remedy is ledum palustr. Where there's a pain and swelling in the leg. And I gave 200 and it always worked. Ledum pal 200 is the best. No 30, no 1M, but 200 good potency for pain and swelling in the leg. I am surprised sometimes how come they noted and recorded these many symptoms. perspiration is very important thing. And one patient, Mr. Singh, was saying, when I'm starting to sleep, I have sweating. People think of Merxol, Natramur, sulfur, Cilicia, but that patient had Daphne indica. Very special symptom when I'm trying to sleep and there's a sweating. Starting from sleep with, and then starter like this. One case is very, very difficult. In spite of giving so many remedies, I could not get the desired result. That the symptoms were sweating on the face while eating. And no, he can't eat any spicy food, any very, very strong food like a masala thing. So I found out that rather than treating the local symptoms, I treat him mental symptoms. Mental symptoms came to belladonna. When I prescribed belladonna, he got much better while eating. Otherwise, because belladonna patients are very quick. Everything happens very quick, belladonna. So when you eat the first food, immediately sweating. It looks very bad, somebody sitting next to you and eating and sweating profusely. So sometime we go for the local symptoms and not taking consideration of the mental symptoms, which are more important. If you go for the mental symptom, there is no science in the world has homeopathy, everything for mind. Just like I tell you one very special case of mind. This remedy, fear, sudden noise, fear. Anyone telling the remedy for the sudden noise, fear of the sudden noise. Somebody sitting, there's another remedy is Kali Carb. But I am talking about two special remedies, Borax and Cocculus indicus. You are surprised sometimes. I'm surprised myself after 55 years of homeopathic practice. Every case is a challenge for you, maybe small or big. So nobody is competent in homeopathy, no one. If somebody says I'm master of homeopathy or something useless, they are lying. So best thing is to find out the symptom and pinpoint the remedy. And if it's a single remedy, it always works. In the case of the eye, granular lips. Any remedy? Granular lips, there are hundreds of remedies, but feeling on the evening only. And the remedy which I selected, you won't believe, it was Nux vomica again. Just like granular lids in the evening only, not in the daytime, not in the afternoon. So this is also remedy for summer. But the patient only told me of the evening. In the evening, I feel like some granular part in my eyes. Yesterday, I had another case of smegma. You know smegma? Anybody tell me what is a smegma? They are not joining. Let's discuss. What is smegma? Yes, that is not accumulated semen, but it is it's not semen. Smegma is different. Smegma is a discharge under the prepuce over the glands. The best remedy I found out was causticum. I don't know what will happen. I gave causticum yesterday only. I will find the result after 2-3 days. Somebody said, I don't know the name of the doctor, just missed there. It's not a semen. Semen is different thing. Smegma is a discharge under the prepuce or over the glands. So we should not be confused. There's another case, very important. It's very, very special case of one patient. He was a Muslim guy. He said, I have a gas in my tummy. flatulence, you were talking, sometime here, sometime there, sometime here, sometime there. Which remedy? I confirmed him, do you eat slow or fast? He said, I'm eating too fast. My wife's always complaining. So what is the remedy for that? Anybody tell me, please? Very special remedy for the people who are eating very fast. They have the big tummy as well. Lycopodium. And lycopodium should not be given. Yellows, yes, Dr. Indra Neelji, yellows is there. But in the Kent repertory, page number 548, lycopodium is a single remedy in bold. We are confused with the one symptom. It should be particular symptom. We should remember what is the complete symptom. Onset, location, sensation, modalities, and concomitant. That is the complete symptom. And totality of these symptoms make a remedy. No symptom is complete if there is no location, sensation, and modalities. Very important. Modalities are very important. Without modality, you can't find out a remedy. I tell you another case of flatulence walking while. We always think of bryonia, but here is a remedy. Walking while, again, lycopodium is the remedy. You know, when I was walking in the high street called the main street, somebody had the flatulence, and the flatus are very offensive. That much offensive that if you're walking behind, you'll feel like somebody just passed some bad air. And for the flatulence offensive, there are hundreds of remedies. And the best remedy, involuntary. Flatus is a flatus, but it's involuntary. Anyone telling the remedy for a involuntary, where you can't control them? It is phosphorus. And flatus during inspiration. When you're breathing in, there is a flatus. Which remedy? Causticum. We have to prove this medicine and confirm them again. And people, there is another case very important was hemorrhage from rectum at night only. So we think of the Merxol and these other, but the best remedy is nitric acid. If it's the bleeding from rectum at night only, hemorrhage from anus night. Single remedy, third grade. No good, is the first grade nitric acid. Another thing, in urethra, there are so many symptoms. Pain in the urethra when passing, flatus. Manganum. I'm surprised sometimes how much effort they have done to make this repertory. And in cough is very important remedies in the cough only. If there's somebody is having a barking cough day and night, Spongia toaster. What a remedy. Spongia is a very good remedy. There was another case, I remember, cough ends into sneezing. If somebody is coughing, then cough ends into sneezing. I'm just taking that rubric out and tell you. Ends in sneezing. And I tell you the page number as well. Agaricus muscaris. Cough and in sneezing. We have to go through repertory, even if you're not treating anyone, just carry on searching the repertory. You will find so many things which can be useful for future. This was a very important symptom. Hair sensation. in trachea, as if something just like a hair is there. Anyone telling the remedy? Silesia. Silesia is the remedy where you feel like there is a hair in the throat. Problem is this: we have to find out the remedy by going through proper checking in the repertory. Otherwise, you won't find remedy. A lot of people are complaining of difficulty in expectoration when there is a symptom here. When it's moving around, it is a better expectoration. When you're walking around, ipeacock. Do you know this expectoration has got very, very precise information. Salty expectoration in the morning. I thought of natromure, but it was phosphorus. Salty in the morning in the salt is a phosphorus. And when I asked more symptoms, surprisingly, the more symptoms came from the phosphorus, just like drinking cold water, chilled water. So this is homeopathy. Dr. Dinesh, how much time we have? Dr. Dinesh, how much time we left?
Sir, we have around 20-25 minutes still remaining.
25 minutes remaining.
Yes, sir. Yeah.
Anybody want to discuss any case? They can ask me, then I can suggest them medicine. No prescribe, but suggest. Anyone from the audience ask me any particular symptom or any case? Let it be practical. Anyone? I can see there are few doctors on the line here, so please ask me if you want to ask me anything.
Yeah, friends, kindly ask because we have got a very senior personality with us. Definitely, you can solve your queries with sir.
I don't mind supporting your practice. Just ask me if there is any difficult case you have in mind. Dr. Dhruv Prasad ji, just ask anything. I'm happy. I will try my best. Anyone? Dr. Sheila, Dr. Blessy, Paul, Dr. Mahmood, Sri Lekha ji, Shah ji, anyone? Ask me anything if you are having difficulty with. I will try my best to help you. No? Everybody is happy?
Sir, some people are maybe thinking for some case. Till then, can I ask you a small query if you don't mind?
Pardon?
Can I ask you some small query till others are preparing their questions?
Yes, ask me anything.
Yeah, sir, normally all our homeopaths face this problem that many times patients are asymptomatic after 40 years of age and they come to the homeopaths for management of blood pressure and diabetes. So can you guide clinically for these homeopaths or for everyone where there are asymptomatic patients?
It is depending on the totality of symptoms.
Yeah.
Diabetes and high blood pressure.
Very true, because it is very common after 40 years of age, and because of the conventional treatments, their symptoms are suppressed, we can say, or they are comfortable, but they wanted a homeopathic treatment, so they come to us as many times it happens. So how should we approach?
We have to find out what is a causative factor.
Okay, that is a very good point.
Some cases are very good with the lycopodium,
Achha.
arsenic album, blood pressure high because the red face, that's a belladonna. Very angry people eating too much and constipated nux vomica.
Okay.
Is the causative, we have to remove the cause.
Okay. That's
if you have the splinter in the nail, it's painful, you should not give the medicine for the pain. You should give the medicine for taking the splinter out. You know remedy, which is a remedy for pushing the splinter out?
Pushing?
Foreign body, Silesia.
Silesia, yeah, Silesia is there. Very true.
Homeopathy is not for 1 month or 1 year teaching. It is lifelong teaching, lifelong understanding.
Yeah. Sir,
Do you
one
know
que-
anyone with a symptom like a very special symptom of wet face, wet feet sensation?
Usually diabetics have it. Usually diabetics have it.
Yes. So we have to go through the causative factor to find out the right remedy. Homeopathy is a cool science. It's not a rushing science. Somebody came in, do you have any treatment for the hair loss? There are hundreds of remedies for the hair loss. You can't pinpoint one remedy. But I said, if you have the hair loss, you tell me what is happening, what you are eating. He said, nothing to do with the food. I said, yes, it is you have to deal with the food. If the food, what you're taking, salt or sweet, the hair loss, I tell you something very for the good remedy for the hair loss. And I'm surprised it works. Hair falling, there are so many remedies, but during the pregnancy, lachesis is the top remedy. Hair falling during pregnancy. And mostly ladies fall the hair during pregnancy, and sometimes this hair triangles stick together, tangles. Any remedy for that?
Phosphorus.
Phosphorus is there, but the best remedy is fluoric acid.
Okay.
I tell you, no one is good teacher other than repertories.
Yeah.
People talk very high, I did this, I did this, I did this. They are just having information from the books only. They didn't invent anything, just like hair becomes gray in young age. Any remedy? Lycopodium, best remedy for the hair, becomes gray in the young age. The hair gray after 50 or 60, but sometimes 26 year, 28 year, 30 year, if the hair becomes gray, not white, they are never white, they are gray. So lycopodium is the best remedy. Problem is, and second is sulfur, but lycopodium is the more important. Phosphoric acid is another remedy, kali iodide and arsenic album. And if the hairs are gray in the spots only like hair, slightly hair, sorinum. Sorinum is most important remedy if you go through it. Sorinum very intelligent. In acute conditions, when patients are not responding to any treatment, the sulfur is a medicine. In chronic cases, sorinum is the medicine. Homeopathy is a wonder science. We are not going deep into the information. Problem is this: if we study homeopathy every day, whether you need it or not, you should go through repertories and Boric Mathematica, Allen's keynote. You will find a lot of things which you were looking for a long time ago. There's a special symptom, heat in the head because of the gas in the tummy. Heat in the head. What a surprising symptom. Heat in the head, breakfast after. Can you tell me any remedy? Heat in the head after the breakfast. Laurus rhesus. It is all there. It's not with me, it's with everyone there. But they don't do the effort. If you go through repertory, the different sections and chapters, you will see magical information. And if you open any page blindly, then you will find something which is not known to others. If somebody is sitting and jerking in the head Any remedy?
Agaricus?
Sepia. Surprise.
Sepia.
Agaricus is very good. I know. But if you go to 1, 2, 3, 9 page, jerking up the head sitting while and sleep during sitting while is sepia. During sleep is arsenic album. That's why I'm saying you have to go through the repertory.
Yeah. Sir, one question has come up. Can we take it if you mind?
Yes.
Like, can homeopathy, yeah, Dr. Victus is asking means, can homeopathy work in Phytoderma vitamin deficiency? Probably he wants to ask about vitamin deficiency, I think. So can homeopathy work in vitamin deficiency?
Yeah, there are some medicines like vitamin D. Calcarea fast is very helpful. But I know, I will tell you, I will not tell you stories because vitamin D deficiency is very good covered by Calcarea fast. That's the most important knowledge I have. And iron deficiency, ferrum fast is there. Iron is not vitamin, but iron deficiency.
Yeah.
While problems natron sulf is very good, biochemic.
Okay.
Acidity, natron fast is very good. Never fails, natron fast and silicea. For brain conditions, kali fast is very good. Kali fast.
Yeah, it's a sedative for brain, very true.
For watering eyes, natron is very good. Watering eyes, sneezing. Homeopathy is not learned, it is explained by books. You can't learn homeopathy. Anybody, why there are many homeopaths? Because they are not good at understanding the philosophy of homeopathy. There are so many sweet shops. Some you say these sweets are better, that sweet is better. Sometimes they make the sweet to just taste your mouth sweeter, but they are not good. They're not proper nourishment. There's no proper quality of the food and sweets. Similarly, I prefer Kent repertory, the best in the world. And I admire Kent. That's why I have a Kent photograph there. Kent, second to Honeyman, Kent is the best. If there are noises in the ear, and if you rub them, then you feel better. You know the remedy, Minianthus. The same thing. If you're rising from stooping, the manganum is the best remedy. Noises in the ear during stool, you'll be surprised it is lycopodium. I'm surprised myself. I feel very happy that I become homeopath. When 1967, I got the admission in National Homeopathy Medical College. My father's friend was joking. He said, "Oh, look, the sweet pills boy." And after 10 years, he got his son admitted to the Bhopal Homeopathy Medical College. After 10 years, Naveen Saxena. So that's why I say we should work hard. We should go and what is the relation of the hand, writing, and ear? Pain in the ear, writing while. Physostigma. A physostigma is a very good remedy for the eye, but pain in the ear, writing something pain in the ear. Who can treat it? No one. Pain in the head. There are so many things which I'm surprised. If you go through repertory, whether you need or not, you keep studying and reading the book. That will be very much. Perspiration and ear, very good relation. Sometimes I open the books and go for hours and hours and hours. I don't want to close the book until I get tired or sleep. For face, I'm telling you something very important for face. Very good symptoms on the face. I'll show you something. Face is a very important chapter, but we don't see too much of the face. Pimples are aggravated by the cold air and cold, which is the remedy for cold aggravation. Arsenicum album, very important remedy. 55 years is a long time. Even then, I don't feel myself competent because this is the endless knowledge. Even Hahnemann at age of 88 was saying, I am not a master. Anybody who claims to be a master is lying. This Dr. Ram Pravesh is saying, angle of treatment. Yes, can you write it again? He was writing something. Dr. Ram Pravesh ji. Nobody is a master. I have not seen anyone 100% master of homeopathy, because homeopathy is a vast ocean. Deeper you go, deep it is. Regarding the speech is a very important thing. Problem of speech is people don't believe. Difficulty of speech during period. What a surprise. Message during citron. Citron is a remedy. And sometimes people speak very loud, very high. Which remedy? Lachesis. Suppose somebody is frightened and he can't speak. What's the remedy? Hyoscyamus. Speech. Somebody talking slow, somebody talking very high. And feeble, very weak. Sometimes people talking and you don't know what they're talking, very listening problem. Roughness of the speech. Calcarea carb. I tell you something more. In expectoration, people don't believe this will happen. Chronic bloody expectoration, sulfuric acid. When changes of weather, there is a pain in the chest. Any remedy? Pain in the chest on the changing of weather. Renin plus bulb. Very important remedy. And pain between the ribs. Very important remedy. Homeopathy is a big ocean. We have to go deep down and then find out. Pain in the spine, cough during. I thought it is a bryonia, but it is not bryonia, it is a belladonna. Cough in the spine, back of spine, cough during. I thought it is a bryonia, but no, it is a belladonna. Surprise. Belladonna first grade. And pain in the back, aggravated by noise. Surprisingly, noise is causing the backache. Arsenic album. I'm confused myself. How come they found these distinctive symptoms, very precise information? Most important thing is you have to see a patient and try this, then you will know it is honestly recorded properly. Every case is important. Every case. Maybe it's a small case or big case. Stiffness in the back, on turning in the back. Tell me which remedy. Turning in the back is stiffness. Oh my God, my back is stiff. You'll be surprised. Not rust ox, but sulfur. Please open your repertory and try to go through repertory every day. You'll see striking symptoms. When stiffness in the back, rust ox, no. Piranha, no. It is sulfur. Surprised, and I think you will be surprised as well. Tension in the back. Tension in the back, dinner after. Nicolum. Tension in the back, better by walking. Ammonium mure. Very good remedy, ammonium mure. Some rare remedies we don't study. Some remedies you don't have in the practice. We have to have the remedy. Coldness at shoulder and extremities after eating. Argentum nitricum. Somebody sent me a message from Pakistan and asking me a remedy for some case. I asked them full symptoms, as much as information you. Then I found the medicine was oleum. It is surprising that you find the remedy, then you're more, confident. Now let's go to the sleep. Very important thing. Very sleep. Sleep is very heavy during the morning. Laxes. Very heavy sleep. Sleeplessness. Diarrhea after. Which remedy? Nux vomica. Skin symptoms are very important. There are good remedies. Pimples. Copper colored pimples, kali iodatum. Itching is a very important symptom. Itching in the paralyzed parts only. Phosphorus. Nobody can tell. After exertion, there is a itching, natromure. Especially in the old people, there is itching. Miserium is the remedy. Miserium. In generalities, we are surprised. In the afternoon, you feel better. Tell me which remedy. Forenoon, you feel better. He's saying, I'm okay. If I tell you second symptom, you will find the remedy immediately. I'm feeling better in the morning. As it becomes afternoon or 4 o'clock, I'm aggravated. Lycopodium, very important remedy.
Yeah. Sir, sorry to disturb you. We are having 2-3 minutes remaining. So is it comfortable that we conclude?
Yeah, carry on. Homeopathy I can go whole life.
Okay. Actually, we had a very good feast of your clinical knowledge and your vast experience of so many years. And really, we enjoyed the single remedy symptoms which you told, and were very important. Sometimes we never thought of any remedy and it is indicated. So this was good learning for us.
I'm always happy when I find the single remedy.
Yeah, but it is a good learning for us today, because usually we were all hunting different symptoms and going towards only polycrest. But today we learned very nice things from you. So actually, now we'll be going to the vote of thanks now. Ram Paresh sir, I would request to say vote of thanks. He's one of the senior most with us. So sir, kindly say the vote of thanks.
Thank you. The very and
Sir, your voice is not coming.
congratulations.
Thank you. Very happy to
Dr.
see.
Shashi
I feel
Mohan
like-
Shah, sir. Very
I
nice.
feel-
Single remedy and single symptom. Select the remedy. Very difficult angle. So very thanks. Behalf
Thank you very much. I feel like I am in India.
IFPH. Hello.
Pardon?
Thank you, sir. Very thanks.
Thank you for joining everyone.
Yeah,
When I get retired, I will come to India.
yeah,
After
sir.
retirement, I will visit
Yes,
the whole country
Welcome.
Welcome. Yeah.
and see my friends homeopath. I will support homeopathy
Mm-hmm.
and I will join everyone
Sure,
wherever I
sir.
see.
Sure, sir. We will like to have your more sessions when you have time once again. It
Thank
is
you,
good,
thank you.
good learning
Thank
for
you.
us. Now
Thank
we are
you.
going to our local language Malayalam session. So I would hand over the session to Dr. Madam Shailya. So kindly
You are
take over.
doing the very good work. You're going. I'm very happy. This morning there was a doctors from India, from
Okay.
Bexon, from Mumbai. So
Okay.
that's why I had a meeting until 4 o'clock.
Okay. I think Bakshi sir's staff may be there. Dr. Bakshi was
Yeah.
in charge of Action. I remember.
Yeah.
Very true. But we are also equally happy to have you as a senior personality, and we would request you to come once again to refresh our sessions. So
Thank
we are
you.
very
Thank you.
thankful to you, sir.
Thank you. Thank you very much. Bye bye from UK.
Sir,
Yeah,
thank you.
thank you, sir.
Bye-bye.
Yeah,
Bye.
Madam Shaila,
Thank
you
you.
can take over the charge. I request you
Thank
to
you.
take over. Yeah.